Wondering if you have a meniscus tear? Well, identifying a meniscal injury is simpler than you may think, if you know what to look for. So in this video, I'll guide you through key signs and symptoms of meniscus injuries, and we'll demonstrate some simple home tests you can perform to assess if you have a meniscus tear. Hey everybody, welcome back for another episode of Physio Show. Tenderness at the meniscus is one of the primary indicators of meniscus injury. As there are two menisci in the knee, pain can come from either the inner or outer side of the knee along the joint line. To examine tenderness in the medial meniscus, begin by bending your knee, locate the side of the kneecap, and move downward until you feel a softer part of the knee. This is the joint space where the meniscus lives. Now apply pressure downward and inward, feeling along the joint line, checking for tenderness. To assess the lateral meniscus, find the outer part of the kneecap and slide down to the softer part of the knee. Apply pressure along the joint line, and any tenderness indicates irritation of meniscal tissue. Another factor to consider when determining the presence of meniscal tears is pain symptoms at maximal ranges of knee movement. These tests are very easy to perform on your own. The first is assessing for symptoms with your knee in hyperextension. You can do this by placing your heels on an elevated surface. Take your hands and slowly and gently force your knee into hyperextension. Pain reproduction in the knee joint is a positive test. The next test will assess symptoms with maximal knee flexion. To perform this test, use your hand to bend your knee as far as it can go. Pain reproduction in the joint is a positive test. Meniscal injuries typically occur with twisting movements while the foot is planted while the knee is slightly bent. For these reasons, the more common orthopedic tests used to diagnose a meniscal tear use twisting motions, as it recreates the stress on the meniscus. One of these tests that you can perform at home is called the Dattilo test. To perform this test, stand on one leg while holding onto a table or countertop for balance. With the knee slightly flexed, twist left and right 3 times. If there is no discomfort, repeat the test with slightly more flexion of the knee. A positive result for a meniscus tear is indicated if pain is reproduced along the inside or outside part of the knee joint, or if there is sensations of locking or catching the knee during the test. This occurs because a torn piece of the meniscus moves into the joint space, obstructing movement, causing the knee to catch or lock. Pain can feel like acute sharp or stabbing pain. It can make it difficult to fully straighten or bend the knee at times. This is called an internal derangement, implying there's a physical obstruction that affects the knee joint's movement. These symptoms are dependent on the location and size of the tear, and more sizable tears are more likely to result in locking or catching sensations compared to smaller ones. Meniscus tears can also create a sense of instability in the knee, almost like the knee just gives out. This occurs primarily due to pain inhibition, a phenomenon where our muscles kind of just shut off a bit when they shouldn't. It's a response our body has when it has pain, and it's a way to protect the area and prevent further injury. This can lead to difficulty and challenges going up and down stairs or even walking. Restoring the function of the muscles surrounding the knee is one of the primary goals of physical therapy, to reduce stress through the meniscus and restore proper movement. In more acute meniscus injuries, swelling often develops in the knee joint. This is usually noticed 1 to 2 days following the injury, leading to feeling of fullness or stiffness in the knee, especially in the mornings. The injured knee might look puffier with less definition compared to the other knee. This swelling can significantly limit knee's typical range of motion, causing stiffness and discomfort, making movements such as bending or straightening the knee more challenging and less fluid. Now, it's important to note that these signs and symptoms may vary in severity and presentation, and not everyone with meniscus tears will experience all of these symptoms. If you suspect a meniscus tear or have persistent knee pain or symptoms, go see a physical therapist. They are trained in diagnosing and treating meniscal injuries and can determine the right course of action. Well, I hope you enjoyed this episode of Physio Show. You can help support the channel by giving the video a like and subscribing so we can continue educating you on your body, how it works, and what it needs to keep moving.